In a decade-long study tracking 1.7 million adults between ages 20 and 50, Stanford researchers identified a drastic anomaly in cardiovascular event rates. This bar chart visualizes the quantitative disparity found in the data. Individuals with sleep apnea face a 5-fold multiplier in their risk of developing atrial fibrillation and a 60% higher likelihood of experiencing a stroke. Society broadly perceives sleep apnea as an auditory nuisance, routinely dismissing it as loud snoring and a minor cause of daytime fatigue. Treating sleep apnea as a mild respiratory quirk ignores the repetitive physical trauma inflicted on the heart. That loud snoring is the audible symptom of a heart fighting a violent, invisible battle in the dark. To understand how this damages the cardiovascular system, we must look past the bedroom and peer directly inside the chest cavity during an apneic episode. We are going to examine the internal mechanics of a closed airway. Analyzing this mechanical failure reveals how a condition occurring during sleep physically degrades healthy heart tissue. An apneic episode begins when the tissues of the upper airway physically collapse, sealing the passage shut while the person is asleep. Despite the blockage, the biological drive to breathe continues. The diaphragm forcefully contracts, aggressively attempting to pull air into the lungs. In medicine, this specific action, forcefully trying to inhale against an occluded airway, is called the Muller maneuver. Sucking against a closed pipe creates an intense internal vacuum, a phenomenon known in physics as negative intrathoracic pressure. The vacuum inside the chest can plunge to extreme levels, reaching a measurement of -65 millimeters of mercury. The chest cavity has effectively become a vacuum chamber, subjecting the heart to a hostile mechanical environment it was never designed to endure. This severe negative pressure acts directly on the heart, applying a physical suction force that pulls on the thin-walled upper chambers, or atria. Simultaneously, the lack of fresh air causes blood oxygen levels to plummet, throwing the body into a chemical state of hypoxia. The nervous system reacts to this suffocation by flooding the bloodstream with adrenaline, aggressively driving up blood pressure. The heart is suffocated, chemically forced to sprint by the adrenaline rush, and physically stretched out of shape by the vacuum. The combination of acute physical stretching and chemical overdrive produces acute cardiac trauma, occurring silently in the dark. This trauma repeats hundreds of times a single night, compounding relentlessly over years. In response to this chronic stress, the heart tissue physically adapts. The walls thicken, stretch, and develop rigid scar tissue in a process known as structural remodeling. This flowchart traces the pathway, showing how negative intrathoracic pressure causes atrial stretch, which produces the erratic heartbeat known as atrial fibrillation. Widening the view reveals a self-amplifying feedback loop. Damaged by atrial fibrillation, the heart loses its ability to pump efficiently. This inefficient pumping allows fluid to accumulate and shift into the lungs and neck when a patient lies down, making the airway even heavier and more prone to collapse. This circular diagram illustrates the clinical reality. Sleep-disordered breathing causes atrial fibrillation, and atrial fibrillation actively worsens sleep-disordered breathing. The structural remodeling of the heart provides the mechanism for the Stanford study's finding, the 60% surge in stroke risk among young adults. When atrial fibrillation forces the heart to beat erratically, blood fails to clear the upper chambers. It pools, becomes stagnant, and forms dangerous clots inside the atria. If one of those clots escapes the heart's chambers, it travels up the arterial highway directly into the brain, completely cutting off the oxygen supply. For these patients, a stroke represents the culmination of years of repetitive nocturnal airway collapse. The CPAP machine functions as critical cardiac triage rather than a simple sleep aid. Using continuous positive air pressure, the device functions as a pneumatic splint, physically holding the airway open through the night. Opening the biological pipe immediately eliminates the negative chest pressure, which stops the violent physical pulling on the heart. Halting this nightly physical stress permanently breaks the vicious cycle and prevents further structural remodeling of the heart tissue. Sleep apnea functions as a violent heart condition operating in the shadows of sleep, making treatment the primary defense against cardiovascular collapse.